in a few minutes. All right. I hope as you guys are starting to come in that everything is okay, that we're not having any issues. All right. Perfect. Okay. All right. Those of you that have questions, go ahead and get it listed. Okay. Okay. We'll get started in a few minutes as people are starting to come in. Okay. We're going to configure YouTube and Facebook so that those of you who are not able to access Riverside. So let me just make sure that everything is connected and integrated. Okay. All right. I think we are good on the YouTube side. And I think we're good on the, hold on. I'm getting a message that we need to give it a second for the Facebook Live. Okay. All right, let's give it a second. Okay. All right. Let's see. Okay, the questions are coming in. All right. Okay, so let me just quickly chat. Please text all your questions. All right. Okay, let's go ahead and let's get started. All right. So the first question is about pricing. Okay, so how do we ensure that the pricing that is listed is indeed the correct price for what you'll be actually paying, right? So, this question has come up quite a few times now, and I think it's indicative of just how well educated a lot of the patients are about all of these programs. So, what I would suggest is you really break down price into three different things: um, membership fee, medication fee, and physician consultation fee. A lot of times, what providers will do is they'll combine all of it and say XYZ price. But more often than not, what will happen is they'll start to mix up the different pricing. So you'll see a situation where you'll see one price that's listed, but then that's not the actual price that you're going to be paying overall because there's different medication fees, there's different fees when it comes to the um, physician consultation. So, what I would suggest you really do is get a clear sense of all the costs that'll go into the overall care by asking up front and say, okay, this is the cost that I'm going to pay. This is what I would expect to pay if management is considered, like medication fees, membership fees, and overall uh, consultation fees from the physician, because those are the fees that really go into what the cost structure will be like. And if they try to bundle everything up, then it's likely that you're not getting a proper understanding of what the overall cost structure would be. All right, let's see. Okay, what is this question? Okay. All right. Now this is one that's uh, really gotten very popular, and that is the 7 to 6 day protocol. When would it be used and when is it appropriate? So the 7 to 6 day protocol is really used for those patients who are stagnating but don't have any objective or subjective parameters that would indicate that the patient is not tolerating the medications well. So this would be like patients who maybe yes, I don't have any constipation. I don't have any issues with nausea, with vomiting. Everything is going well, but I'm just not losing weight. So, what can I do, doctor? Well, what happens with the GLP-1 medications is that over time, the concentration decreases. Hence, that's why you have to take the dose on a weekly basis. But where do we come up with this idea about taking it every week? Well, it came from just approximations on what the overall concentration of the medication is over time. There's no real sort of rhyme or reason when it comes to why this would be more relevant than not, or why this would be needed at a certain 7 day interval. It was just convenient. So when we shift from a 7 to 6 day interval, what we're doing is helping to increase the baseline concentration because you're never letting the GLP-1 medication get too low to where you need it to come back up. You're keeping it at a steady state. And by keeping it at a steady state, what you're allowing the GLP-1 medications to do is to stay at a higher concentration than it would otherwise. And that allows the GLP receptors to be activated at a higher rate. Hence, the medications will be quote unquote more effective. But this is only going to work if your body is not resisting the medication. Now, what do I mean by resisting the medication? When you have nausea, when you have constipation, these are subjective assessments of the medication's resisting intake in your body. Your body's saying, well, I don't want this dose. I am resisting it. So that's when you need to understand, hey, why is my body resisting the GLP-1 medications? Do I need to engage in certain behavioral modifications? Do I need to adjust my diet? And once you've optimized things from that perspective, then you can start to understand, hey, these are the body's resistance to GLP-1 medications. That's how you need to look at side effects, because what the clinical literature is trying to suggest is that these side effects, quote unquote, as we start to understand them, are not true side effects in that they are from the medications themselves. They are from the improper use of the medications. Now, that's kind of a distinction without a difference in many people's minds. But really, what that does is make people recognize that, hey, there's a right way of taking the GLP-1 medications. And if I take it the right way, then I will lose weight. So long as you don't have any factors that are resisting the body's intake of the medications, you will start to tolerate the medicine. And once you demonstrate that you can tolerate the medicine without any resistance from the body, well, at that point, we can then say, well, why are you still not losing weight? And hence we can go from the 7 to 6 day protocol. All right, let's see what else we got here. Okay, all right. A couple of the same questions. All right. Hmm. Okay, one person is saying the Facebook feed is not coming in. So let me just take a quick look over there and figure out what's going on with that. Hmm. Okay, I think that should be it. Let's see. Mm, let's see. Let me just quickly text somebody to make sure that you guys can see me on. Okay. Okay, I see what's going on. Okay, so I don't think that the Facebook Live is exactly working just now. What I can do is I can create parallel streams, so then that way you guys can see me on Facebook, and then you can see me on Riverside as well. Okay. Okay, let's see. Let's see if this does it now. Okay. Okay, so I don't think that we're going to be able to get the Facebook Live component set up just yet. I apologize, but while you guys are still here, let's just keep going and let's just keep answering some questions. Okay, so let's see what else we got here. Okay, all right. So, what are the most common side effects? So, of course, nausea, vomiting, diarrhea, constipation. The key side effect that you should really look out for early on when you get started is going to be the nausea. Subsequently, you need to look at the constipation. Now, I don't think many people have really broken down that distinction. What you want are what you want to do is recontextualize the side effects as points of body resistance, and I think that's the critical way to look at it. Is the medication actively resisting in your body? And if that is the case, then what you need to do is you need to assess when and how you can optimize that. And what happens is initially you'll start to feel a little bit of nausea, and then subsequent to that, you will feel constipation. And those are the body's forms of resistance as the concentration is decreasing over time. All right, perfect. Any other questions? All right, short and sweet. I love it. Thank you so much. Now, of course, if you have any questions, just go ahead and send us an email at patients@prestige20.com. Thank you.